I'm Karen McPhail-Bell, and I completed my PhD earlier this year, which researched the practice of deadly choices at the Institute for Urban Indigenous Health. I'm excited to hear that Nathan is talking to you today about the work that Deadly Choices is doing in social media and leadership in health promotion. Nathan asked me to take a few minutes to share a little about the research that I did with Deadly Choices. I will keep it relatively short because Nathan and Elena are the experts talking to you today about the work of Deadly Choices. Before I go further, I want to acknowledge the traditional owners of the land upon which I live and work, the Bedigal and Gadigal people, and pay my respects to elders past and present, as well as to other Aboriginal and Torres Strait Islander people listening today. Aboriginal people never ceded this land. I also want to thank the Institute for Urban Indigenous Health and Daily Choices for their long-standing support of our work together. To respect Aboriginal protocol, I will establish my connection to what I will share today by briefly introducing myself. I am a non-Indigenous Australian with English, Irish, Scottish heritage. I was born in Perth but raised in Beaudesert and Brisbane. And while I consider Brisbane home, I have been living in Sydney for 2 years now. Currently, I work for 2 universities. I work for the University of New South Wales in the Centre for Primary Healthcare and Equity, and I work for the Central Queensland University in the Office of Indigenous Engagement. My PhD with Deadly Choices was an ethnographic study of health promotion practice in an Indigenous community-controlled setting. Now, ethnography uses participant observation to become intimately familiar with a group of people by being intensely involved with them. So, using participant observation meant that I could be part of the day-to-day practice of the Deadly Choices practitioners as they worked with Aboriginal and Torres Strait Islander people across southeast Queensland during fieldwork a couple of years ago. My PhD was in part a response to the scarcity of health promotion research that learns from Indigenous-led health promotion, and also to the public health tendency to position Aboriginality as illness-producing and problematic, with little reflection regarding its role in the lack of improvement in Indigenous health. So in light of this, I have an interest in strengths-based health promotion and in decolonising methodologies. Please contact me if you would like further information about the research design itself. Now, in fieldwork with Deadly Choices, it was clear early on that social media is a key site for their health promotion practice. And I'm sure Nathan will talk to you today about the strategies that they use. In my observations, their approach to social media appears to create a safe, inclusive, positive space where community members can profile their healthy choices. This means that Indigenous community members can choose their healthy choices using their own words. Now, it could be that a Deadly Choice is family time, being active, getting an education, going to TAFE, pursuing a dream career, and so on. And so this approach is a clear contrast to the preoccupation of mainstream health promotion with individual risk factors such as substance use, nutrition, and physical activity, and the associated behavioural and lifestyle interventions. Now, this isn't to say that Deadly Choices doesn't focus on lifestyle messages, because they do. However, Deadly Choices promotes a healthy lifestyle agenda according to holistic Indigenous notions of health and identity, which span across the social determinants of health. Now, what also strikes me about Deadly Choices online is the dialogue that is taking place between Deadly Choices and the online community. So there's retweets and reposts and immediate responses and shout outs to their online community. And all of this together provide tangible evidence of Deadly Choices practitioners listening to the community. Now, that practitioners are listening is a contrast to the mainstream health promotion narrative that tells people how to live healthier lives. Have a look at Twitter when you can to see the way that Deadly Choices welcomes a new follower. When this happens, Deadly Choices immediately opens up a dialogue about what a healthy choice might be for this person by asking the question, "What's your deadly choice?" I observed responses to this question um, that involved pride and strength and much more than just a narrow, healthy lifestyle agenda about nutrition, physical activity, and so on. Likewise, I observed community members sharing their achievements, such as giving up smokes, and Deadly Choices would respond by celebrating these choices and achievements. In doing this, Deadly Choices are positioning Indigenous people as leaders. Deadly Choices practitioners also promote the work and achievements of Aboriginal people and of the students in their programs beyond a typical healthy lifestyle agenda. So, in this way, Deadly Choices health promotion in social media involves community promotion and the facilitation of a culture of pride and strength. Effectively, Deadly Choices are focusing on changing a culture, changing cultural norms, which is a point of difference to other health promotion uses of social media. Deadly Choices use social media to share the ownership of Deadly Choices and its brand more specifically, and therefore of the meaning of Indigenous health and healthy behaviours. In doing this, Deadly Choices are repositioning Indigenous identity as health promotion and Indigenous people and communities as leaders and as health promoters themselves. One example that I think shows this reframe is the Deadly Choices slogan, "Urban is the new black." You might have seen this slogan promoted already on Deadly Choices social media or merchandise. Now, this slogan positions urban Indigenous identity as something that is cool and to be proud of and to be associated with being healthy. Now, consider the public health backdrop to this approach, where Indigenous Australians tend to be positioned as sick and dying and requiring outside intervention. In particular, urban Aboriginal and Torres Strait Islander identity is heavily contested in mainstream discourse and constructed according to mainstream perspectives. We often hear the myth that real Indigenous people only live in rural and remote areas, or that urban based Indigenous people are lost to their culture. Other times, urban dwelling Indigenous people are seen as not traditional or authentic enough for mainstream imaginations. So there is a deeper meaning happening here behind the way Deadly Choices work to affirm and to connect the normality of urban dwelling and Indigenous Australians, and that Aboriginal and Torres Strait Islander people are leaders. So, to sum up, I believe that the way Deadly Choices uses social media shares power between health promotion practitioner and community. And in doing so, Deadly Choices are upholding health promotion principles while resisting the deficit labels of public health regarding Indigenous Australians. So, thanks for your time today. I hope you enjoy your lecture with Nathan. Please do feel free to contact me if you have any questions or you'd like to talk through anything. Nathan can put you in touch with me, or you can look me up on Twitter at Solomon_Kaza, or I'm on ResearchGate as well. Thanks. Bye.